Module name: Learning Disability or Intellectual Disability. Question number 1. The risk of developing Alzheimer's disease in Down syndrome is increased most by A. Chronic anxiety, B. Eczema, C. Family history of Alzheimer's disease, D. Mild learning disability rather than severe learning disability, E. Obesity. Let's look into the risk factors of developing Alzheimer's disease in patients with Down syndrome. This includes age, which is the most important risk factors. The others include family history of Alzheimer's disease, presence of apolipoprotein E4, being a male, and lacking estrogen. All these are important factors responsible for earlier Alzheimer's disease expression in people with Down syndrome. Among the options, family history of Alzheimer's disease increases the risk of developing Alzheimer's in people with Down syndrome. Therefore, answer for question number 1 is C. Question number 2. Microcephaly is a characteristic feature of A. Marfan syndrome, B. Fetal alcohol syndrome, C. Fragile X syndrome, D. Hydrocephalus, E. Soto syndrome. Microcephaly is a characteristic feature of fetal alcohol syndrome, which occurs due to maternal alcohol consumption while they are pregnant. The important features of fetal alcohol syndrome includes microcephaly, short stature, mid-face hypoplasia, short palpebral fissure, thin upper lip, hypoplastic long or smooth philtrum. People with this syndrome also have mild to moderate level of intellectual disability. If you look at the options, in Marfan syndrome, the head circumference is usually normal. In Fragile X syndrome, the person may have macrocephaly. In Soto syndrome, it's a form of cerebral gigantism, and again macrocephaly is a feature of Soto syndrome. Among the options given here, microcephaly is a characteristic feature of fetal alcohol syndrome. The answer for question number 2 is B. Question number 3. A 5-year-old boy with severe learning disability has a round face with hypertelorism, slanting palpebral fissures, broad flat nose, and has infantile cat-like cry. Which one of the following condition is he most likely to suffer from? A. Down syndrome, B. Crittu-Chat syndrome, C. Smith-Magenis syndrome, D. Williams syndrome, E. Angelman syndrome. Infantile cat-like cry is a feature of Crittu-Chat syndrome. This syndrome occurs due to partial deletion of 5p chromosome. The characteristic cry is like that of a kitten, also called as infantile cat-like cry. The other important features are pronounced microcephaly, round face with hypertelorism, slanting palpebral fissures. The person may also have severe to profound mental retardation or intellectual disability. Question number 3. The correct answer is B. Crittu-Chat syndrome. Question number 4. The MECP2 gene and protein appear to be essential for the normal function of nerve cells. Abnormalities within the gene are seen in which of the following disorders? A. Autistic spectrum disorder, B. Rett syndrome, C. ADHD, D. Fragile X syndrome, E. Angelman syndrome. abnormalities within the MECP2 gene is seen in a condition called Rett syndrome. This is mainly found in girls. Around 6 to 18 months after birth, the speech and motor function capabilities start to decrease. The person may also present with seizures, growth retardation, cognitive impairment, and motor impairment. The MECP2 locus is X-linked and the disease-causing alleles are dominant. This is a picture which shows MECP2 gene abnormalities in affected female with a diagnosis of Rett syndrome. Question number 4. The answer is B, Rett syndrome. Question number 5. Which of the following genetic variants of Down syndrome shows less cognitive impairment and milder features than other variants? A. Full trisomy of chromosome 21. B. Mosaicism. C. Robertsonian translocation. D. Both translocation and mosaicism. E. Duplication of a portion of chromosome 21. Mosaicism is a variant of Down syndrome. It's a mixture of normal and triatomic cell lines. Most individuals with Down syndrome have mild or moderate level of intellectual disability. Those with mosaic Down syndrome typically have IQ scores that are 10 to 30 points higher. Therefore, the answer for question number 5 is B, mosaicism. In this genetic variant of Down syndrome, they may show less cognitive impairment and milder features than other variants. Question number 6. Which of the following genetic disorders are not explained by sporadic mutations? A. Prader-Willi syndrome. B. Rubinstein-Taybi syndrome. C. Noonan syndrome. D. Williams syndrome. E. Turner syndrome. Turner syndrome is not caused by a genetic mutation but by a missing or abnormal X chromosome. Some medical conditions are caused by a single gene mutation passed on to a child by parents. This includes autosomal dominant, autosomal recessive, and X-linked conditions. Some genetic mutations are known as sporadic. These mutations are not inherited but occur during gametogenesis and postzygotically. All of the listed disorders except Turner syndromes are explained by sporadic mutation. Therefore, answer for question number 6 is E, Turner syndrome. This is a genetic disorder which is not explained by sporadic mutation. Question number 7. The following is true regarding offending behavior in patients with learning disabilities or intellectual disabilities. A. Damage to property is the most common offense. B. People with intellectual disability are more likely to commit violent offenses. C. Prevalence of learning disability in prisons is nearly 40%. D. Offending rates are higher in profound learning disability. E. Recidivism is lower compared to offenders without learning disability. The correct statement is A. Damage to property is the most common offense regarding offending behavior in patients with intellectual disability. People with intellectual disability are less likely to commit violent offenses. The prevalence of intellectual disability in prisons is not as high as 40%. The offending rates are higher in people with borderline or mild intellectual disability but not in profound learning disability. Recidivism refers to repetition of an offense or crime, and this is higher compared to offenders without learning disability. Therefore, question number 7, the true statement is option A. Question number 8, which of the following scale is useful in the assessment of Alzheimer's disease among the learning disabled population? A. Abbreviated mental test score. B. DMR. DMR stands for Dementia Questionnaire for Mentally Retarded Person. C. NINDS ADRD criteria. D. MMSE. And E. CAMCOG. The correct answer is B. DMR. DMR stands for Dementia Questionnaire for the Mentally Retarded. It is widely used. According to studies, this questionnaire reported sensitivity up to 100% in identifying dementia. Therefore, the answer for question number 8 is B. DMR. Question number 9. Which of the following disease is inherited in an autosomal dominant manner? A. Sanfilippo disease. B. Hunter's syndrome. C. Hurler syndrome. D. Leschnyhan syndrome. E. Tuberous sclerosis. Tuberous sclerosis is a condition which is inherited in an autosomal dominant manner. If they are inherited in an autosomal dominant manner, then there is a 50% chance of offspring having the disease. So this particular slide refers to autosomal dominant inheritance, where there is 50% chance of offspring having the disease, and tuberous sclerosis is inherited in an autosomal dominant manner. Sanfilippo disease is inherited in autosomal recessive manner. Hunter syndrome is inherited in X-linked recessive manner. Hurler syndrome, again autosomal recessive. Leschnyhan syndrome, X-linked recessive. So, among the options given here, option E, tuberous sclerosis, is inherited in an autosomal dominant manner. Question number 10. A patient has autistic traits, litanic and jovial speech, but poor eye contact. What is the most likely diagnosis? The term litanic refers to long and repeated speech. Options are A. Turner syndrome, B. Klinefelter syndrome, C. Down syndrome, D. Fragile X syndrome, E. Leschnyhan syndrome. If you look at the behavioral phenotypes of people with Fragile X syndrome, about 5 to 10% of them have autistic disorder and they present with autistic traits. They also have a lot of language difficulties, which could be in the form of perseveration, echolalia, palilalia, cluttering, litanic and jovial speech. Therefore, the answer for question number 10 is D. Fragile X syndrome. Question number 11. Which of the following features is not suggestive of Lennox-Gastaut syndrome? A. Absence seizures, apathy, dizziness. B. Most often appears between ages of 2 and 6. C. Multiple seizures every day. D. Diffuse slow interictal spike waves in waking EEG. E. Progressive increase in IQ. Let's look at the features of Lennox-Gastaut syndrome. It's a difficult to treat form of childhood onset epilepsy. It appears between the 2nd and 6th year of life. This syndrome is characterized by frequent seizures and different seizure types. The child may develop mental retardation and a progressive decrease in IQ. Daily multiple seizures are typical. The most frequently occurring seizure types are tonic, which are often nocturnal. 90% of them occurs at night time. The second most frequent seizures are myoclonic seizures. Half of these patients will suffer from status epilepticus, usually the non-convulsive type, which is characterized by dizziness, apathy, and unresponsiveness. If you take the EEG, it may show spike wave complexes. If you look at the options, A, B, C, and D are all features suggestive of Lennox-Gastaut syndrome, but E is not suggestive of Lennox-Gastaut syndrome. There is no progressive increase in IQ, but there is a progressive decrease in IQ. Therefore, the answer for 11 is E. Question number 12. Which of the following is correct about velocardiofacial syndrome? A. It occurs in around 1 in 4,500 people. B. Large ears and wide palpebral fissures are important physical features. C. It is usually associated with severe learning disability. D. It is usually associated with cognitive impairment and dementia. E. It is due to microdeletion of chromosome 21. Let's look at the features of velocardiofacial syndrome. It is also called as Dye-George syndrome. It occurs due to microdeletion of chromosome number 22. It occurs in 1 in 5,000 live births. The prevalence of schizophrenia in people with velocardiofacial syndrome is around 22%, which is the highest known risk factor for development of schizophrenia. If you look at the options, option A is the correct answer. So, velocardiofacial syndrome occurs in around 1 in 4,500 to 5,000 people. So, answer for 12 is A. Number 13. You are seeing a 50-year-old man with Down syndrome in the learning disability clinic with behavioral changes. He may be developing Alzheimer's disease. Which of the following tests would be most useful in establishing a diagnosis? A. Mini mental state examination. B. Dementia scale for Down syndrome. C. Addenbrook's cognitive examination. D. Abbreviated mental test score. E. Cambridge examination for mental disorders of the elderly. Most often, people with Down syndrome who often go on to develop dementia present with behavioral symptoms. Therefore, dementia scale for Down syndrome is one of the useful tests in establishing a diagnosis. Question number 13. The answer is B. Dementia scale for Down syndrome. Question number 14. In terms of offending behavior of adults with learning disabilities, which of the following statements is correct? A. Adults with severe learning disabilities are likely to be convicted of murder. B. Adults with severe learning disabilities are likely to be found fit to plead. C. Adults with borderline and mild learning disabilities account for most of the offending behavior. D. Fire setting is the most frequent offending behavior observed. E. Violent sexual offending is more frequent than physical aggression. Adults with borderline and mild learning disabilities are 3 times more likely to account for most of the offending behavior than others with no learning disabilities at all. Therefore, the answer for 14 is C. Question number 15. Melatonin is considered to be an effective treatment for children with learning disabilities and sleep disorders. Which of the following significantly improves on treatment with this drug? A. Sleepwalking. B. Sleep latency. E. Early morning wakening. D. Sleep apnea. E. Number of night wakenings. Melatonin is considered as first-line treatment for childhood insomnia. When patients are treated with melatonin, the number of night awakenings are significantly reduced, total sleep time is increased, and sleep latency is also reduced. Question number 15. The correct answer is E. The number of night awakenings significantly improves on treatment with melatonin. Question number 16. What is the prevalence of schizophrenia in people with learning disability? A 1%, B 3%, C 5%, D 7%, E 9%. If you look at the prevalence of schizophrenia in people with intellectual disability, it is 3%. In normal population, it is 1%, but for people who have intellectual disability, the prevalence is increased by threefold. Question number 16, answer is B, 3%. Question number 17, a couple have a child with Down syndrome. The risk of having another child with the same syndrome is highest if their first child has which of the following? A. Translocation Down syndrome, B. Mosaic Down syndrome, C. Disomy 23 Down syndrome, D. Trisomy 21 Down syndrome, E. Trisomy 23 Down syndrome. In terms of Down syndrome, it is the most common genetic cause of developing intellectual disability. It is due to trisomy of chromosome number 21. Down syndrome is due to trisomy of chromosome 21. Full trisomy 21 occurs in 95% of cases. Robertsonian translocation is seen in 5% of cases, of which 45% show fusion, usually between chromosome 14 and 21. Mosaicism is seen in 2 to 5% of cases. If their first child with Down syndrome happened due to Robertsonian translocation, then the risk of having another child with the same syndrome is highest. The answer for question number 17 is A, translocation Down syndrome. Question number 18. Which of the following statements is true regarding post-traumatic stress disorder in adults with learning disabilities? A. Symptoms resolve within a few weeks following the traumatic event. This is actually false. It takes about 1 to 6 months for the symptoms to resolve following the traumatic event. B. Comorbid depressive symptoms are less likely than in adults with average intellect. That is false. Comorbid depressive symptoms are more likely. C. It is highly likely to be diagnosed in adults with severe learning disabilities. That is also false. It is more commonly diagnosed in adults with mild to moderate level of intellectual disability. D. It includes exaggerated startle response. That is the correct answer. E. Nightmares are occasionally reported. That is false. Nightmares and poor sleep are commonly reported. Question number 18. The correct answer is D. Exaggerated startle response is a feature seen in people with post-traumatic stress disorder, and it is also commonly seen in adults with intellectual disabilities. Number 19. Leo is a 7-year-old boy with mild to moderate intellectual disability. His parents are informed that his cognitive difficulties are due to the most common inherited cause for intellectual impairment. A. Autosomal recessive, B. Autosomal dominant, C. X-linked dominant, D. X-linked recessive, E. Paternal disomy. If you look at Fragile X syndrome, that is the most common inherited cause of intellectual disability, and it is inherited in an X-linked dominant pattern. When the mother is a carrier of the Fragile X chromosome, each child has a 50% chance of inheritance. People with Fragile X syndrome also have mild to moderate level of intellectual disabilities. Therefore, the correct answer for 19 is C, X-linked dominant, which is Fragile X syndrome. Question number 20. In males with Fragile X syndrome, which of the following statements is correct? A. The mean IQ in affected boys is 20 to 30. That is false. In Fragile X syndrome, they have mild to moderate degree of learning disability and the mean IQ is around 50 to 70. B. The mean IQ score in adulthood is stable with increased age. That is false. The mean IQ score in adulthood goes down with increasing age. C. There is a relationship between the length of DNA trinucleotide repeat and the level of intelligence. This statement is correct. In Fragile X syndrome, CGG repeat varies from 50 to more than 230 full mutations. Higher the length of CGG repeats, the level of intelligence actually goes down. Question number 20. The correct statement is C. There is an inverse relationship between the length of the DNA trinucleotide repeat and the level of intelligence. All other statements are incorrect. Question number 21. Which drug is licensed for the control of aggressive behavior or intellectual self-harm in learning disabled or intellectually disabled population? A. Buspirone, B. Lithium, C. Fluoxetine, D. Naltrexone, and E. Carbamazepine. Lithium is a drug which is licensed for the control of aggressive behavior and also intentional self-harm in intellectually disabled population. Therefore, the answer for 21 is B. Lithium. Naltrexone is also used for people with repetitive self-injurious behavior. It is helpful acutely, but it is less effective in the long term. Question number 22. Which of the following suggests a subcultural rather than a biological cause for learning disability? A. Moderate or severe impairment in intellectual abilities. B. Men are more commonly affected than females. C. Equal distribution across families of different types of socioeconomic status. D. Dysmorphic features are common. E. Intellectual ability is impaired in family members. So we have to find out which statement suggests a subcultural rather than biological cause for intellectual disability. Let's look into the difference between subcultural intellectual disability and biological or pathological type of intellectual disability. In subcultural type, the person may have mild to moderate degree of intellectual disability. In biological type, the person may have moderate, severe, or profound type of intellectual disability. Subcultural type is more common in lower socioeconomical group. Biological type is evenly distributed across all social groups. In subcultural type, often family members may also have borderline IQ. In biological type, family members often have normal IQ. In subcultural type, dysmorphic characters are less likely, but in biological type, dysmorphic features and characters are very common. Subcultural type, syndromic features are not seen, but biological type, syndromic features are often seen. Subcultural type, behavioral phenotypes are rare, but in biological type, behavioral phenotypes are frequent. These are the main differences between the subcultural and biological type of intellectual disability. If you look at the options, moderate or severe impairment is seen in biological type, not in subcultural type. Men are more commonly affected in biological type, not in subcultural type. Equal distribution across families of different types of socioeconomical status is also seen in biological type, not subcultural type. Dysmorphic features are seen in biological type, not subcultural type. Now, option number 5, intellect is impaired in family members. So if you look at the subcultural type, family members may also have borderline IQ or slightly low IQ. Therefore, question number 22, the correct answer is E. Intellectual ability is impaired in family members. This is suggestive more of a subcultural type rather than biological cause for intellectual disability. Question number 23. IQ assessment was carried out on a 7-year-old boy with history of delayed developmental milestones. His IQ was calculated to be 56%. What level of intellectual disability does he have? A. Mild intellectual disability. B. Moderate intellectual disability. C. Severe intellectual disability. D. Profound intellectual disability. E. Subnormal intelligence. If you look at the IQ for different types of intellectual disability, in mild, the IQ is anywhere between 50 to 69. In moderate, the IQ is anywhere between 35 to 49. In severe type, it is anywhere between 20 to 34. In profound type of intellectual disability, the IQ is below 20. In borderline intellectual functioning, the IQ is anywhere between 71 to 84. In the question here, the IQ is about 56%. This is mild intellectual disability or mild LD, where the IQ is anywhere between 50 to 69. Therefore, the answer for 23 is A, mild level of learning disability or intellectual disability. Question number 24. Among those with intellectual disability, what percentage of patients suffer from severe disability? A, 85%, B, 10%, C, 4%, D, 1 to 2%, E, 15%. If you look at the prevalence, mild level of intellectual disability is seen in 85% of people. Moderate level of intellectual disability is seen in 10% of people. Severe intellectual disability is seen in 4%. And profound mental retardation is seen in 1 to 2%. The overall prevalence of developing intellectual disability is 1 to 3%. Intellectual disability is 1.5 times more common in men. Highest incidence is seen in school-age children with the peak at ages of 10 to 14 years. Question number 24. The correct answer is C. 4% of patients with intellectual disability have severe form of disability. Question number 24. The correct answer is C. 4% of patients suffer from severe disability. Question number 25. Those with Down syndrome who survive into their 40s and 50s show pathological brain changes similar to A. Frontotemporal dementia, B. Vascular dementia, C. Parkinson's disease, D. Alzheimer's dementia, E. Huntington's disease. For patients who have Down syndrome, when they survive into their 40s and 50s, a lot of them show neuropathological changes similar to Alzheimer's disease. Almost all of them show brain changes, but 70 to 75% of them exhibit clinical features of dementia. If you look at the brain scans, they show reduced brain weight, reduced gyri and cortical thinning. Postmortem studies show high incidence of senile plaques and neurofibrillary tangles. So 25, the correct answer is D. Those with Down syndrome who survive into their 40s and 50s show pathological brain changes similar to Alzheimer's dementia. Question number 26. In adults with intellectual disabilities, dysphagia is a known side effect of which of the following drugs? A. Lithium, B. Naltrexone, C. Propranolol, D. Clonazepam, E. Fluoxetine. Dysphagia is commonly seen in people with intellectual disability, and it occurs more often due to medications. medications that alters the levels of alertness, for example benzodiazepines, medications which can alter the muscle tone or coordination, for example baclofen and again benzodiazepines, antipsychotic medications which can delay the swallow process and increase salivation, leading to dysphagia. If you look at the options, clonazepam is a benzodiazepine, so that is more likely to cause dysphagia. 26 answer is D, clonazepam. Question number 27. A 7-year-old boy has moderate degree of intellectual disability. He is socially disinhibited and excessively friendly. These are all behavioral phenotypes of which of the following conditions? A. Prader-Willi syndrome, B. Angelman syndrome, C. Williams syndrome, D. Leschnyhan syndrome, E. Di-Georges syndrome. Social disinhibition with abnormal friendliness with strangers is a behavioral phenotype seen in people with Williams syndrome. So in Williams syndrome, the children often present with hypercalcemia, which is seen in 50% of cases, and they also have supravalvular aortic stenosis with unusual phases. The typical phases is called as elfin-like phases. They have broad forehead, prominent cheeks, wide mouth and a flat nasal bridge. The other features are short stature, growth retardation, hoarseness of voice, premature wrinkling and sagging of the skin. So question number 27, the answer is C, Williams syndrome. Question number 28. Among learning disabled population, pica is more commonly seen in which of the following conditions? A. Down syndrome, B. Autism, C. Fragile X syndrome, D. Rett syndrome, E. Fetal alcohol syndrome. Pica is a common problem seen more in children with learning disability. The risk increases with severity of cognitive impairment. The important risk factors are being male, having poor cognitive functioning, autism and being non-verbal. Good level of activities of daily living was a protective factor against pica in children with intellectual disability. So question number 28, the answer is B, autism. Pica is more commonly seen in learning disabled population with autistic features. Question number 29, Miss Jane Williams is a 34-year-old woman with a diagnosis of Down syndrome and moderate intellectual disability. She lives with her mother, who is struggling with her physical health. Her mother is aware that Miss Williams is at increased risk of developing Alzheimer's disease and is wondering about what she might see if this occurs. Which of the following is a more common presentation for Alzheimer's disease in people with Down syndrome compared to those without? A. Functional deterioration, B. Memory problem, C. Personality changes, D. Disorientation to time and place, E. Word finding difficulty. Personality change presenting with behavioral and psychological symptoms appear to be a common presenting feature of Alzheimer's disease in individuals with Down syndrome compared to the general population. This is even more frequent among younger individuals and those with more severe intellectual impairments. These prominent personality and behavior changes associated with executive dysfunction may indicate a frontal involvement, but the pathological diagnosis is likely to be Alzheimer's in most cases. Therefore, the answer for 29 is C. Personality change is a more common presentation for Alzheimer's disease in people with Down syndrome. Question number 30. Mr. Edward Hughes is a 23-year-old man with autism spectrum disorder and moderate intellectual impairment. He lives in a placement and has been demonstrating aggressive behavior over the last several months. Attempts to identify the cause of his distress or address his behavior through non-pharmacological methods have been fruitless. Which of the following would be the most appropriate treatment for him? A. Fluoxetine, B. Atomoxetine, C. Mirtazapine, D. Risperidone, E. Methylphenidate. Risperidone and aripiprazole have the greatest evidence base for the pharmacological management of aggression in autistic spectrum disorder. Other second and first generation antipsychotics, anti-epileptic medications, lithium, naltrexone, and N-acetylcysteine have also been used, although with less evidence base being available for these agents. Question number 30. The correct answer is D. Risperidone. That would be the most appropriate treatment for him to control the aggressive behavior. Answer for 30 is D.